Davin Lim, Dermatologist. So you would like to know more about how to treat male pattern baldness or androgenetic alopecia. So the first thing we want to do is to make sure that the diagnosis is correct. Your dermatologist then will start you possibly on a topical or on an oral agent. The most popular topical agent is minoxidil, and the concentration is 5% twice a day. Now, how minoxidil works is that it increases the duration of your hair phase. In other words, it's like an anchor, and it hangs on to your hair follicles and reduces shedding. It also prevents or reduces miniaturization of hair follicles, which is common or pathognomonic of androgenetic alopecia. So the first thing is with topical minoxidil. If you're pretty bad with using topicals, your dermatologist may prescribe you oral minoxidil, generally speaking between 1 to 2 milligrams in a compounded solution. The side effects can be discussed with your treating dermatologist. From there, they will discuss with you the use of DHT blockers. And these tablets block the enzyme which convert your testosterone to the more potent DHT, which is implicated in shrinking down the follicles. And we can use one of two tablets. One of it's called finasteride, and the other is a dual blocker called dutasteride. With these tablets, you have to be on this long term. If you stop, basically your hair loss will progress to a level of which it would normally progress without being on these tablets. So you won't have a rebound, but basically you have a regression back to your genetic mean. From there, your dermatologist can discuss the use of PRP or platelet-rich plasma. Basically, it's extraction of blood from your own, which is autologous platelets, and then that is instilled back into your scalp using injection techniques. Generally speaking, a cycle of between 3 to 4 treatments are required, spaced between 4 to 6 weeks apart. Thereafter, your dermatologist will maintain you at 4 to 8 month intervals. PRP is a good, safe option prior to the consideration of follicular unit transplantation. There are other procedures which your dermatologist can discuss with you, including low-level laser therapy or LLLT, and that can be using certain LED lights or in some cases fractional laser. Now, when you are on medical therapy, generally speaking, that's a very good way to halt early hair loss. So the earlier you treat your hair loss, the better the outcome. PRP, on the other hand, provided you're caught in an early stage, can actually regrow hair, increase your follicles, and postpone the requirement or possible requirement for surgical intervention with time. So at the end of the day, be guided by your dermatologist as to the best solutions for hair loss.